My name is Xavier Caro. I'm a physician, rheumatologist, clinical immunologist here in Northridge, California. I'm also the director of the Southern California Fibromyalgia Research and Treatment Center. We're talking about fibromyalgia and how we approach it here at the center. These videos are meant for my patients to better inform them, instruct them in what they are experiencing and how we go about treating fibromyalgia. If you're a visitor, you're welcome. I hope you enjoy this tape and the ones that we produce before them. Please take a moment to watch them if you haven't already. At this moment, we're talking about how the insufficient or frankly deficient immune system, and more specifically the humoral immune system, causes, in quotes, fibromyalgia. Now, let us assume then that you have an immune system which has probably been insufficient since birth. This insufficiency is not severe enough so that you succumb to infection at the time of birth or shortly thereafter. As I've mentioned before, if that is how profound your immune deficiency is, then we'll never see you here in our adult rheumatology clinical immunology clinic. On the other hand, if you have minor immune deficiency or incomplete immune deficiency, particularly in our population, an absence or deficiency in one or more immune globulins or subclasses, then we believe that you then are going to be subject to certain infections throughout your life, particularly when you're young and have less immunity. And these may manifest themselves as sinusitis, pneumonia, and the like. But later in life, due to the imbalance in the immune system and its inability to regulate itself, you will have the development of inflammatory disorders. Some of these are frankly autoimmune disorders in which the body is attacked by its own immune system. Some of these situations may become profound enough and recognizable enough so that they become identifiable as specific disease entities. Now, with respect to fibromyalgia, we reason the following. The deficient immune system is not really capable of dealing with all the infections it encounters and may overreact to one or more of these. Yes, overreact, not underreact. Now, these infections could theoretically come from anywhere in the body. They could come from chronic infections in the lungs, in about the head and neck, on the skin, and so on and so forth. And you may know people, or you yourself may have had some kinds of recurring or chronic infections. These could have served as triggers for the immune system to overreact. There is, however, one area of our body which is constantly, yes, constantly infected. Now, you may not think about this without a little bit of guidance, but consider our intestines, particularly the large intestines. This is an area which is normally filled with billions and billions of bacteria, viruses, and the like. And they would normally serve to overstimulate the immune system at any time, except for the fact that there usually are detectable mucus and tissue barriers between these bacteria and the immune system and our sterile innards. Now, imagine if you had a relative deficiency in any protective mechanisms or more than one mechanism in the intestine. For example, let's assume for the purpose of this discussion that your immune system is not whole. That is, that you have minor or mild immune deficiency. Recall, if you had severe immune deficiency, you'd have died when you were a youngster. So the minor immune deficiency has gotten you through for years and years. But eventually, for various reasons, there may be a breakdown in the tissue barrier between the bacteria and the lining of the intestine, which in fact is loaded with immune cells and immune globulins. Now, let's assume you don't have a proper amount of immune globulin. Do you recall that I said that immune globulin A, or IgA, is particularly important because it lines mucous membranes and more specifically the intestines, both large and small. Interestingly, IgA subclass 1 guards from the mouth to the appendix, which is the junction between the large and small intestine. IgA subclass 2 guards from the appendix to the rectum. And we think this may have something to do with the data that we have showing the various kinds of profiles and immune globulins that we see in fibromyalgia. In any case, be that as it may, remember that IgA may be the most important immune globulin in protecting the intestines, but it's not the only one. There are other immune globulins required, and we do have patients who are not IgA deficient who have trouble in this area. At least we believe they do. And what trouble do we think we see? More specifically, in the average patient, symptoms of irritable bowel syndrome. Now, you may have heard of this condition. You may even know that you have it. But many fibromyalgia patients do not know that they have irritable bowel syndrome. Typically, patients with irritable bowel syndrome have either recurrent diarrhea, recurrent bouts of unexplained constipation, or an alternation between those two. They may also get abdominal bloating, unexplained pain, and relief from some of these symptoms with defecation. If you think you fit into that category, you may have irritable bowel syndrome. A very high percentage of our patients have that. Interestingly, some patients with fibromyalgia do not think they have irritable bowel syndrome and will tell me proudly that they are as regular as can be. And when I ask them about what they're describing, they'll tell me, well, I have one bowel movement every day or one bowel movement every other day. And I point out to them, even though they're regular and have very few other symptoms, if any, that's still probably not normal, or at least not ideal. More likely, they should be having more like 2 or even 3 bowel movements a day. Sort of like a pigeon, you eat, you poop. This is the way it was meant to be. I quote here thinkers in this area. Be that as it may, irritable bowel syndrome is known to be associated with inflammation of the bowel lining. Imagine if you had irritable bowel syndrome and had insufficient immune globulins. If you did, then that inflammation might lead to chronic stimulation of the immune system, or just a frank breakdown in the barrier between these noxious bacteria and our sterile innards. If that happens, then there becomes, shall we say, a war between the immune system trying to hold these bacteria at bay and the bacteria themselves trying to do what nature told them to do, and that's expand, multiply, eat, survive. When that happens, this war may, and probably does, spill out inflammatory products of all kinds. These products have a lot of interesting names, and immunologists spend a lot of time studying them and putting together the puzzle of this inflammation. As a general rule, we can group some of these inflammatory products under the rubric of cytokine or cytokines, also known as interleukins. These particular products circulate in the immune system and are relatively noxious. Enough of them can actually kill you, and probably do occur with profound and overwhelming infections of our body. We believe that the average patient with fibromyalgia has recurring cytokine storm, that is, a cytokine release and perturbation of their internal equilibrium and milieu from these inflammatory products. And we believe that treating this is the key and the secret to ridding one of fibromyalgia. Now, unfortunately, if it were that simple, if it were that simple, then we might not have as much trouble as we do. We think that as time goes on, the immune system probably re-equilibrates itself at a higher checkpoint in which inflammation is more difficult to shut off, even if the bacterial content of the bowel are better controlled. And we'll talk about that in a moment. More importantly, when bacteria and certain products of the bowel or certain normal tissues of the bowel combine, the immune system may mistake one particular bacteria and one particular normal tissue for a target. That is, there is crossover or cross-reactivity between these targets such that the immune system accidentally learns that these normal tissue products are, in fact, enemies. And this is what we term autoimmunity. So, autoimmunity may occur when the bacteria or bacterial stimulation of the immune system combines such that the immune system accidentally attacks both the bacteria and its own tissues. That leads to more recognizable phenomena. Sometimes these phenomena are great enough so they're given specific names. But even if they're not, we believe here at the center that there is a transition between fibromyalgia and certain other inflammatory rheumatic disorders. And we would point out, it is our belief, that certain patients, perhaps all patients, but certain patients with rheumatoid arthritis also have much of their symptomatology arising from this crossover and transition into a more inflammatory and recognizable disorder. Next, I'm going to outline for you how we are able to prove that there has been a sufficient aberration of the immune system and the inflammatory products such that it leads to recognizable tissue injury in the fibromyalgia patient. Thank you.